doing today? I hope we've had a good day. It's beautiful out here. It's summertime, so it's nice, bright, and beautiful. I'm loving the summer season. I'm happier though in the summer. The sun makes me happy, actually. Yeah. Good evening, everyone. Good evening. I hope you're well. I hope you're having a beautiful day as I am. Wherever you are, I hope your day has been beautiful and bright and sunny with plenty of sunshine. That's what we have here where I am. Summer's a beautiful time, isn't it? Hello. Just coming to 7 o'clock. Gonna just wait and let people join. Hello. How's everyone doing? I hope we are well. I hope it's been a beautiful Thursday for us. And the sun is nice and bright and high where you are, because it is here. In fact, I changed where I usually will sit to have the IG live, because I thought, oh God, it would be horrible to sit in a study with everywhere looking a bit dark and cozy. I thought I wanted natural light, so I came to a different space where I can have brightness. Hello. It's 1 minute past. I'm waiting for people to join. Hello, welcome. I'm going to give you a few more minutes and let more people join in before we get started. Hello. Thank you for joining. Just going to give you a minute more, so just let more people join in. How are we doing? I was just saying that it is nice and bright where I am. I hope you're having a beautiful, bright summer day as well. It's beautiful when it's summer. I smell better when it's summer. And I'm sitting somewhere where I have flood of natural light coming in. Hello. How are we doing? I'm still waiting for the doctor. I haven't seen her join the room. Well, thank you for joining. I'm going to get started. It's 2 minutes past. Oh, the doctor just joined. So before I let her in, Dr. Moji, please request to join. Quickly, I want to share my thoughts, as I always do. Today, we're talking about decoding periods, and my guest today and my professional guide today is Dr. Moji Adegbite. But quickly, before I bring in Dr. Moji, I wanted to share a scripture that was in my mind actually for a couple of days now. It's from 1 Corinthians 6:12. I like the Passion Translation especially. It says, it's true that our freedom allows us to do anything, but that doesn't mean that everything we do is good for us. I am free to do as I choose, but I choose to never be enslaved by anything. And for me, that's really important. I don't know about you, but we're in a season where everything's happening, a lot of things are happening, and people are getting more and more confused. But it's interesting that God loves us enough, and gave us free will, And another scripture that got me also thinking was Isaiah 49:16. It says, "Can't you see I have carved your name, on the palms of my hands. Your walls are always my concern." Like, God loves us so much, and yet He gives us free will, but most importantly, not letting the things that He's giving us, the blessings, have us, But every blessing, everything, every resource is supposed to be used, as a tool to do more for Him and His kingdom, and for the benefit of mankind. God loves people, so we should be lovers of people. Anyway, I just wanted to share that, with us this evening. Thank you. I'm going to bring the doctor in so we can jump into today's conversation. talking about, if it's the first time here, this is a Feminine Health and Fiber Support Network. And here we just talk about, we have conversations around feminine health issues. We provide support to our community through relevant conversations like this one, handholding, peer-to-peer support, education and lifestyle, encouraging women to speak up and promoting mental health awareness and dealing with cultural biases. So this is what we do at the FHF Network. So today we're having one of those conversations. Today's conversation is around period, decoding period. If there's pattern, color, or flow of our period, what does that mean? Does it mean anything? Are there vital signs that we should, or patterns or color that we should be looking out for that suggest that we may need to seek professional help? Dr. Moji, I admitted you in. I'm just gonna try and see. I'm waiting for the doctor to join in. Good evening. Thank you, everyone who's joined. We're just waiting for the doctor. There she is.
Can you see me?
No, I see some clock light.
Oh my
instrument.
God. Okay, hold on.
Was that a fan?
It was.
We're not going to talk about menopause today. We're just going to keep it. We're going to keep it to period. Thank you for joining me today. Thank you, Dr.
Thank you.
Today we're talking about decoding periods. I'll just share it with people before you join. And actually, I'll let you introduce yourself. Dr. Moji is a general practitioner. Today she's helping me decode periods, colors, patterns. I do have a few questions that I'm going to ask you, but you introduce yourself first, Dr. Moji, and then we take you from there.
Okay. My name is Moji Adegbite. I'm a GP and with interest in women's health, all things women's health. So, yeah, pleased to be here. Thanks for inviting me, Tony.
Thank you for coming. Thank you for always coming. Thank you for always coming. It's a pleasure having you. And we're going to be learning some decoding, if you like, some period stuff today. So I was saying that I wonder if colors and patterns of flow of our period mean anything. But before then, I want to talk about I know some people who started the period at 9 actually because I went to a boarding school. But I started late actually. I think I started about 14. I was already in GS3, and because I was in a boarding school, my mom prepared me as much as she could. Before it happened when I was in school, so I was kind of alarmed, and I was like, oh, what's going on here? And then, of course, my classmates, some of them who had started, guided. But okay, actually, I do have sanity pad in my suitcase and all of that, and then of course the learning started and all of that. But honestly, it was learn as you go. Like now where there's a lot of stuff where you can go and Google stuff and see what's going on and learn. These days my daughter even kind of tutor me on some things. I'm like, oh, okay, where did you find that? Oh, I looked it up. I'm like, lucky you. Nowadays there was no looking up of anything. But without telling our age, seriously, let's jump right into it. I do have a few questions, but honestly, I wanted to get your help on decoding. First of all, we'll talk about the colors, what different colors will mean, during your period, and then the flow pattern. What will that? And lastly, we'll talk about hygiene tips and all of those. So if you wanted to start with colors, if you have, I know there are different colors. I've read up a bit about as well, and honestly, from heavy flow, from dark, black, kind of bright red, to pinkish looking type, all of that. So if you please help us to get started. But before we jump into that, actually, one question came to me just before, actually it was yesterday. And I thought, maybe we should talk about that before we start to talk about the colors, because if I leave it till the end, I might forget. Dr. Moji,
Yeah.
PMDD. Tell me a bit more about PMD. Tell us about PMDD. And because apparently there's a certain young lady who's affected by that recently, and the mom was really
Mhm.
concerned. So I thought, you know what? Let's talk about PMDD, and then we'll talk about the colors and the patterns of our period. You know.
Okay. Well, yeah, we're talking all things
Mm-hmm.
periods tonight.
Mm-hmm.
And, like Toyin, like you said, every woman's experience is probably different. Um, and like you rightly said, yeah, those in our age group probably just, groped in the dark and learnt along the way. But
We did.
thank, thank goodness, the younger ladies after us, have a bit more information than, we did.
Mm-hmm.
And I think the most important thing to note about periods is, you know, knowing your own body as a woman. Because what might be normal for me may not necessarily be normal for the next person. So once a young lady starts periods, that's when she starts to, she needs to start monitoring her body. She needs to start monitoring her flow. What's the color? What does it look like? Making a note of it. In fact, if you have to write it down, write it down. And
Journaling,
yes,
absolutely. I encourage every woman
exactly.
journaling. Honestly, it
Yeah.
helps.
And because this is what, as you go along, month after month, you now know what is normal for you. Similar to
So how
when,
long is that window to say, okay, maybe from the time someone starts till when would you know that, okay, in the last how many months is your guideline to say, okay, this is normal, or anything after that time, okay, should I be watching that? It's not. What's your normal time? When do you
I think,
gauge your
I would normally give it up to about a year
okay, that's
from
good to know.
onset, because for young ladies that just start their periods,
Mm-hmm.
it can be a bit hit and miss to start with.
Okay.
So, and in fact, in some young ladies, it can take even up to a year to settle. So
Yeah.
I would leave it till, because there's no point, a young girl of 11, 12 who's just started periods, there's no point giving a label at that point. So you give it
Right.
at least a year to
Oh
sort of
yeah.
settle down. Except, of course, symptoms are so extreme that, you can't wait a year. You have to do something about it.
Oh.
But otherwise, we normally, because we have a lot of parents coming, oh, the periods are not coming regularly. That's, that's expected. So,
Yeah, that's why I asked that
um,
question, because you find a young person after 3 months and then it doesn't come and you're like,
yeah,
oh, what's going
exactly.
on? Yeah.
And they're panicking, type thing. So,
Mm-hmm.
you just reassure and say, it's okay.
Mm-hmm.
So the reason it's important to know that is, you start to learn your body, when I'm coming up to my period, I start to feel this, my breasts are a bit heavier, they're a bit tender, I
Mm-hmm.
feel a bit, moody type thing. So, you start to note all of these things now, and, they come, they pass, your period is gone, you wait again till and do it all over again. However, there are women in whom it's so bad that they can't function.
Mm-hmm.
These symptoms might be so bad that they can't function. Their mood swings are horrible. They have headaches. They're bloated. They have to take time off school. They have to take time off work. That's when we start to talk of premenstrual disorders.
Yeah,
If
man.
if you ask most women, they do have a few of these things, but it's not, you carry on, as normal. But
Mm-hmm.
in some women, it can be really
Yeah.
debilitating.
Mm-hmm.
Um, which is why, we're happy that there's more information now. Toyin, thank you for what you're doing, because people are becoming more aware that, oh, it's not just that, that time of the month again. And, you
Mm-hmm.
know,
Mm-hmm.
so for some people, it can be, a big problem,
Mm-hmm.
which may require treatment with medication, or just lifestyle changes. In fact, could be, what some people need to change, what they're eating, exercising a bit more, hydrating. Really, really important. Unfortunately, when we start out as young girls, nobody really tells you these things, you know.
In fact, when I was when I was in secondary school, in boarding school,
Yeah,
and there was a particular senior actually who every month used to
yeah,
had to go to the
yeah,
hospital. And I thought, why is she so extra? Like she needs to go to the hospital for this same period, But
yeah,
I was judging her without me knowing,
yeah, how
her
bad it can
situation.
be. Yeah, yeah.
And then she have to go to the hospital with, PMS. We're all happy.
Drama queen.
But no,
Yeah.
it's not.
No, no, no.
Mm-hmm.
In fact, even the mood angle of it,
Mm-hmm.
for premenstrual disorders that can be the most evident symptom. When some women will say, I'm just irritable, I'm angry, I don't know why, or I'm anxious and I don't know why. Some women get really bloated, so it's something that young girls should be taught about, not to make them fearful of the
Mm-hmm.
condition, but just so that
Mm-hmm.
they don't accept something that can be managed. Because you can imagine being in employment or being in college or something, and you're having these symptoms and you don't know what is wrong. If you can decode that
Mm-hmm.
this could be the problem, you seek the right help, then you get the support that you need.
Okay, thank you for that. So as a GP, Dr. Moji, someone
Yeah.
comes to you with severe PMS. So is
Yes.
there a referral kind of thing? Is there, how do
Yes.
you guide them? Is there a what's the next step? Someone comes and, okay, this is severe PMS,
MDD.
PMDD, or whatever name it's called. What? How do you guide them?
So normally what we do is, obviously depending on the symptoms they present with,
Mm-hmm.
depending on the symptoms, depending on the severity. Sometimes it's that initial conversation about what's your lifestyle like,
Right.
what, what do you do? What's your typical day like? What activities do you engage in?
Mm-hmm.
So those are the initial conversations. And depending, if it's sort of not severe, that's really debilitating,
Mm-hmm.
then we discuss things like them changing their lifestyle,
Okay.
those kind of things, cutting down on alcohol or stopping if possible, stress levels, we
Mm-hmm.
ask about that. So these are all the things we look at. And depending on, obviously, what the woman wants to do, some women will not straight away want to have medication, which
Okay.
which is
Mm-hmm.
good. We try to avoid medication if we can, but if it's sort of moderate type symptoms, it's affecting them, then we can try medication. And medication being, normally it's the combined contraceptive pill
Right.
that we use. But
Mm.
obviously, not all women may be able to have it, for whatever reason. In
Mm-hmm.
those kind of cases where it's not quite straightforward, or their symptoms are really severe, and you're thinking, well, actually, could there be something else here?
Underline.
Then we can refer them to the gynecologist
Okay.
straight off the bat. Yeah. Or what we can do sometimes is we can start them on the contraceptive pill
Mm-hmm.
while they wait to see the gynecologist. Of
Gynecologist.
course, knowing that the NHS, there's always a wait between referring and getting an appointment. So that's how we sort of manage.
That manage that. Oh, amazing. Thank you for answering that. That was really useful. Okay, so now let's talk about regular, well, not regular, let's talk about periods. First of all, let's talk about colors.
Yes,
What colors are okay? What, I know we talked, oopsie, I know earlier on you talked about everyone needs to find out what their own normal is,
yes.
and so, but even with the colors, is there, what's not normal? If maybe I can ask it that way, what's not normal for
Okay.
colors?
So I mean, we all know red, the color of blood is red, you know. So a period would be bright red, you know,
Bright red.
sort of bright red, you know, normal flow. That is what you
Mm-hmm.
get. Now, obviously for periods that are sort of quite heavy,
Mm-hmm.
yes, you might find that, you know, you have a lot of bleeding. Anyway, that's more flow. But you have bright red, then you have black. You could have episodes where the blood seems a bit dark, maybe not
Okay.
black, but maybe a bit
Dark,
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 dark
like
red,
dark brownish kind
or
of one.
dark brown type
Mm-hmm.
bleeding. On its own, that might not be an issue because it might just mean that, you know, the blood is taking a bit of time to come out. It's
Okay.
not, it's not, if it's heavy, then, you know, you don't tend to see those darker shades because the blood is coming out quickly.
Okay.
But if it's coming out a bit slower, then you get the brown, you could get the dark brown discoloration. Or if you have things like, that's why we always, you know, ask people about the timings of their period. So it's really important that people are, you know, keeping note of, you know, when was my last period? When was the
Right.
date? Am I taking my contraception properly type thing? That's important because sometimes when we see this dark blood, people have
Mm-hmm.
tummy pains, they're not sure about their periods. You start to think, is this an ectopic pregnancy? So these are
Mm.
some of the things that, you know, one has to think about. Now, it could also be black, as in black, black.
All
Yeah,
right.
because the reason it gets black is if you leave, you know, sort of blood exposed to, you know, oxygen for that length of time, it will
Mm-hmm.
get really dark and it's not coming out quickly. So if you have people with lighter periods where the blood is not gushing out,
Okay.
then it tends to stay a bit longer in the uterus and could get black. But it can be quite dramatic and shocking, you know,
I can imagine.
when you see black and you think, right, what is going on inside me? But yeah, it's not it's not anything of concern really.
Ah,
It's just
okay.
obviously you also want to think, okay, is there anything that could be preventing the blood from coming out easily, you know?
Okay.
So those are the things to look out for, especially, you know, if you have people that are using like tampons and things like that.
Ah.
Even though with
Mm.
that, if a tampon is in, the first thing you'll probably notice is the smell, you know, before you see, you know, the
So,
blood.
so
There,
with the dark. Sorry, I wanted to just
yeah,
run it again. With the dark or brown one, as long as you can eliminate that, it's not maybe a miscarriage or ectopic
yeah,
pregnancy kind of one. It's probably just
it's
a
nothing.
blockage of some
Yeah,
sort. The blood not coming out quickly or not flowing
yeah,
as it. Okay, so nothing to worry about.
nothing to worry about.
Amazing. Okay. What other color?
So
What
there's also been, you know, if it's a bit pale, if it's a bit pink, it might just be the fact that there's, you know, secretions, you know, cervical secretions, or, you know, is the woman anemic? You know, if she's complaining she's a bit
Ah.
tired,
Mm.
you know, so it might be that she's anemic. So, you know, a simple blood test will sort that out. You know,
Okay.
sometimes if there are infections as well, you know, you could get um orange or gray colors.
Mm.
Yeah. Now, in my time of practice, which would be about 24 years now,
Okay.
I have not seen a woman complain of gray blood
Great.
or orange blood.
Uh-huh.
However, that is possible. Now, however, if we're talking about vaginal discharge,
All right.
that's a whole different matter, you know. But as for, you know, period blood that's flowing and is that color, no, I've not seen it. But, you know, these are possibilities. If there's infection, then you can get some of
So
these
so
sort of
so
colors.
for that for those variation like the orange or
Yeah,
the green, okay, we know that we've
gray.
said established that the pink one is maybe most likely you're anemic or
Yeah,
there are other things going on.
yeah,
So get that checked out definitely.
yeah.
So with the orange and the gray, So I wanted to check. So will that the color change? Will that be something during your normal flow, or something that happens in between the flow, in between the period
So I
times?
lost you there. I lost you there. You froze a bit.
Oh, okay. Sorry about that. So I was saying that the color variation. So
Mm,
we said pink already.
yeah,
You want to check pink out because it might be maybe
anemic.
other things that you want to look up. So
Yeah,
definitely check out pink if you have pink. But the other variation which you mentioned was also the orange and the
gray.
gray, which you haven't seen. But so I wanted to also check. Will that be like during the flow of the period, the color can be orange or gray due to infection, or will that be in between periods?
So that's why I was saying that will be more like discharge rather than, these are the ones we're talking about, the red, the brown, the black, that you can see as free flowing blood. These other ones, chances that you see like gray blood flowing is unlikely. So you might just see that on the pad as, a bit of discharge, maybe at the end of a period or before.
Mm.
Because sometimes what happens is a woman has an
Mm.
infection. Once her period starts, you might not necessarily notice the discharge because she's bleeding. There's a lot of blood coming. So it's after, towards the end, she starts getting that discharge back again. So, but if there's any sign of that, then, having a swab test is quite simple
Okay.
to check
Well,
out, which infection.
that might be. Oh,
Yeah.
awesome. Thank you for that. That's quite informative. All right. So I reckon that's all for the colors.
That's all
So we
for
want to talk about
the colors.
the flow and pattern. So we know that all right, the normal red color is fine. Well, if
Yes,
you've got pink, you
yes,
want to check it out.
yeah,
Yes, and
absolutely.
yeah, if
And if
you
it's,
have brown, orange,
yes,
yeah, it might not be anything, but
but
you still want to ask questions. At
exactly,
least do some
exactly,
investigative
exactly.
uh, um, things to see what your situation is, but it's not anything to worry about. So
No.
thank you, Moji. Let's talk about the flow pattern. From the heavy and the light.
Yeah,
And also for every woman, I know you've said is different.
yeah.
Know what your normal is, but how much is okay? Like for someone who you will usually have um the clots, in their
Mm,
period, how much is too much,
right.
that to say, okay, I need to look into this, so we know that we have from heavy to light.
Mm,
Some people, I know someone when I was growing up, I was like, how is this even your period compared to people like us who will wear the normal pad
I
on and
know.
we have to change
Yeah.
every 4 hours, and this girl can just go on, and I'm like, what is this, so
So, yeah. So, I mean, generally, you would say a normal period should last about 3 to 7 days, sort of. Most women will sort of fall within
yeah,
that range.
yeah.
Now, in terms of flow, you find that, people that are really heavy, like you were saying, you find they're having to change their pads so frequently and it's soaked through.
Mm-hmm.
I know they normally give a sort of range as to how much blood a woman loses, but when you look at it, the blood is on the pad. It's really difficult
To
to quantify.
measure.
Exactly. And when so really you'll find that most women will find that if they're having to change up to, couple of hours, having to change a pad and it's soaked through, then that's a problem.
Mm.
So yes, for a woman that might be her normal flow. However,
Mm-hmm.
it's not to say it will not affect her, because it might not be that there's anything particularly wrong with her, but
Mm-hmm.
a woman bleeding that much could quickly become anemic. So
Mm-hmm.
in a sense, that's a problem. Now, you also have women that, again, their flow is very light. They're
Mm-hmm.
hardly bleeding at all. So first, you look at the number of days. then you look at in those number of days, how many pads am I, because that's the easiest way to, apart from now when some women are using the menstrual cups.
The cups, yeah, I was going to talk about that
Yeah,
towards the end. Okay.
yes. So where women are using the menstrual cups, it might be easier to quantify, but otherwise it's actually just how many pads how often am I
My
changing
changing.
my pads? If it's anything sort of less than, 3 hours, I'm having to rush to go and change each time, I'm having to use big pads, then, clearly that is heavy bleeding. Now, as to the number of clots, again, it's what's normal for me.
Okay.
Because most women will have a period without clotting. Now, if you have a period where you have 1, 2, 3 occasional clots, that's okay. But when you start to see large chunks of it, 50 p coin size, you're having loads of them coming through, a clot will form because the bleeding is a lot. So
Okay.
where you start to see blood
Okay.
clots, it means,
The
this
flow.
is heavier type of
Okay.
bleeding. So if my normal period is I don't clot, then if I start to see it, that should start to
Ring alarm bells.
send, ring alarm bells that, oh, why am
Oh
I
my.
clotting this
Okay.
time, type thing. What we normally say to women though is, if you have a blip in your normal cycle, say, my cycle has usually been fine, and then this month, I start to see something different. Don't panic.
Okay.
Don't panic, because it could just be by the time you come around to next month, your period is back to what it used to be.
Can it also be like hormonal changes kind of thing
Precisely.
that? Okay.
Precisely. So it could be hormonal, it could be your environment, it could be your stress levels, it could be what you're eating, So it could be those things. So it may not necessarily be something that needs intervention
Right.
straight away. So normally we say, give it another month, another couple of months, see what happens. If it doesn't stabilize, then obviously we'll start, sort of looking into it, except if it's extreme symptoms. If it's extreme symptoms, then, we can't say wait another month or couple of months. But if not, usually the body might just, settle.
Wow. Interesting. Thank you so much for that. That got me thinking, and I remember,
Mhm.
when I was much younger and I got
Yeah.
introduced to, I've always been a heavy flow person. So that's why I used to just wonder, why will somebody, not be as heavy? Oh, sorry. As I see my one, because I used to get
Yeah.
confused, but so I got introduced to tampons. I thought, oh, it's
Mm.
cool to know where to
To
wear
try.
tampons. I want to wear tampon. Why can't I wear tampon? And I find out that I wear tampon after 2 hours.
It's,
I'm needing, like, who has
it's
time
so
to be
cute.
changing hair so frequently? So I wear the tampon and I put the pad on. Like, we are not doing this. We must wear this tampon.
Yeah. Yeah.
So and for me now, thinking about, hey, was that a sign that I should have picked up to say, okay, maybe I should have checked this out to say, why are you wearing tampon and pad at the
And
same
pad
time?
at the same time.
That is this, even though your flow is usually heavy, is
Yeah.
there something else that
That's
is
going
making
on.
us
Yeah.
going on? In retrospect, I'm thinking,
Yeah.
maybe those are the signs
Yeah.
that one should have had conversations around and discussion. But as far as that's concerned, it's okay. Nobody said anything's wrong with me, so I
Yeah.
just live my life. But I wanted to be able to wear tampons. So,
Yeah.
thank you,
No, but
for that.
that's sorry. I was just going to say, yes, that's another question to ask, because you like you're saying now, you would wear a tampon and then wear a pad, meaning that was a lot of bleeding. So it's like someone telling you, I have to put two pads together at the same time. Again, in your mind, that's telling you this person's bleeding is heavier than usual, because otherwise they shouldn't have to do that. So these are the questions you would ask a woman that comes, and has a complaint, what is she actually doing during her periods? How many pads is she using? How often is she
Right,
changing?
right.
And then I think the other side that we miss about
Mm-hmm.
periods is the psychological impact, you know, or the emotional and societal impact. You know, how does it affect her, you know, day to day? You know, some women are thinking about their next period and they're worried because they know what is to come. You know, so those are important
No.
questions, you know. Yeah,
Mm-hmm. Mm-hmm. Absolutely, and I agree with you because honestly, oh, there were times where
mm,
it was serious
yeah,
thoughts and worry and
yeah,
concern when my period is coming because I mean, back in the days when I was working in the city, I had a separate bag. It
yeah,
was just for pads,
yeah.
you know. And sometimes even in my building in the office, I will in the toilet, I had to keep
Yeah,
some,
in the
stacked away, and I'll tell the
yeah,
cleaner, do not touch, don't nobody touching this,
yeah,
because that was how bad it
it
used to be
was.
and how
Yeah,
heavy,
yeah,
because once I get up from my desk, I have to
you just
run, literally
yeah,
walk quickly to the bathroom before I start to, so those were times where I used to worry a lot,
yeah,
like, oh God, or somebody will tell you, in the middle of open plan office that, hey,
yeah,
don't do
yeah,
like this,
yeah,
so yes,
yeah,
it can be very emotionally stressful.
yeah, yeah, very. So, you know, so that's and you know, it's such a brilliant thing now that women can speak up about periods,
Mm-hmm.
about what they're going through and
Mm-hmm.
things. Um, and you know, it's once a woman identifies, you know, there's a problem with her period, you know, speaking to her GP, they can refer to the
Mm-hmm.
gynecologist because there are tests that can be done to find out what the issue is. So,
Okay.
you know, don't feel that there's nothing that can be done. There are things that can be done. That's why these specialists are there. You know, it might just be having a scan to check if there's anything in the womb. You know, are there any fibroids? Are there polyps? You know, these things can be checked. Sometimes doing blood tests to check hormone levels might be
Mm-hmm.
necessary, you know, depending on, you know, what, you know, if, for example, the woman is having irregular
Right.
periods, you know, blood tests are
Okay.
important to check if there are any underlying conditions. Is she anemic? Does she have thyroid problems?
Okay.
You know, these are all things um, that can affect periods. So, you know, it's really important. Polycystic ovary syndrome,
Right.
you know, can make periods irregular. So, you know, there are things that can be done. So, like I say, the first thing is don't panic, but if it persists, 100% have it checked out.
So yeah, have you checked out if you persist? But so some of the things I got from what you've said is you contact your doctor or you start to investigate or ask questions or
Yes.
contact your GP if your cycle is irregular and
Yeah.
maybe the length of days change or
Yes.
anything that's not normal to you.
Normal
So
for you.
you have to know you're normal. And then once
Exactly.
something is not normal, don't panic, but begin to look into
Yeah.
it, ask questions, you
Exactly.
know, and so that you can handle or deal with things earlier on, and thank God you've said there are blood tests that can be done to see what might be going on,
Yeah.
so that's useful. So I would say if anything that's not your normal, every woman is different. Know your normal, and once something's out of your normal, and like we said when we started, journaling
Yeah.
is really,
Yes.
really important. I don't know about you
Very.
guys, but sometimes I forget these things.
Yes.
I don't know what you people do, you GPs, because when I'm feeling this pain or like I'm booking this appointment, I need to go and this just tell my GP everything. I get there, I forget half of the things. I freeze, So I learned that journaling is my best friend. I have written
It
everything
is.
down. When I'm feeling this, I'm written. So when I get there, all that you people's 5 minutes, 3 minutes is out of the pin because I must tell you everything that is on my list, at this appointment because I don't know when I'm going to be able to get another one, But no, seriously, journaling is really
It's
important and
important.
it helps you, the patient and also the GP to be able to
Yeah.
diagnose and help you with wellness, on your journey. So another thing that I so if the period has not occurred for 3 months or more, should you be worried? And they're not
Yes.
pregnant.
I was just going to say, because that's the first thing, if the woman is sexually active, of course, yes, that would be the first thing we would ask. But yes, if no period for 3 months, yes, you have to start thinking what's going on here. So this is where, we get to the issue around, doing tests and things.
Okay.
She's not on contraception that would stop her period type
Mm,
thing. Yes, then clearly, she needs to go to her GP, and then depending on, what they agree, either the GP will initiate some tests, or they can refer to gynae, or while waiting for gynae, start doing some tests, i.e. ultrasound.
okay.
So an
Oh,
ultrasound is always key, in looking at the lining of the womb, um, seeing, if there's anything there, and then obviously doing some blood tests, So those are sort of the two basic things that would be done, to find out why, before, depending on the reason, then we manage accordingly. But yes, it would be important, no period for 3 months, no explanation. Yeah, definitely that needs
concern.
an assessment. And when you go to see the doctors, don't, be clear about, it's not, and that's why you need to journal, because it's not a case of go away and keep an eye on it. No, I've
I've been
been
watching
I've been watching it.
it.
I've already watched it. Yes. I've already watched it. It's not right. I want it looked into. So yeah,
I,
definitely.
thank you for highlighting that. And again, I'm going to say, honestly, don't let anyone push you over. Don't let anyone, because,
Yeah,
and sometimes I find out that it's because when we haven't done our own due
yeah.
diligence, the GP will come and tell you, oh, go and watch you, oh, because they're trying to keep to their, I don't know
Mm,
how many minutes you guys have, three or
yeah.
5 minutes. So
It's 10 minutes.
is it 10 minutes? Ah, okay, so
10 minutes.
it looks to me like five. So because if you haven't done your own due diligence, someone comes and say, okay, go and start to do this. But if you have, if you
Yeah,
know, if you have looked, if you have written stuff down,
yeah,
by the time I'm going to you, I'm coming armed too. I'm ready for
yeah,
you.
yeah.
So,
Yeah.
and we have to be in that kind of position, that posture, that mindset. Because if
Mm,
not, they're busy. They just want the next
yeah,
person to come, and all of that. So we must do our own homework as well, have our journaling stuff, make sure by the
yeah,
time we're going there, we're telling them this is how I'm feeling.
yeah.
I've been checking it, I've been looking at it for so long and all
Exactly.
of that.
Yeah,
Thank
quite
you.
quite
Always
clearly.
insist. Yeah, be clear and insist,
Yeah.
until you get the help
And
that you. Mm-hmm.
yeah, and one thing I just wanted to say, one thing I've noticed, these days is, if you have a lady come in and you ask about her periods, which I find quite good, is immediately they pick up their phone, and say, oh, you're asking about their last period. They pick up their phone, they open it, and they give you the date. So that awareness is coming. People are using apps to monitor their periods. So it's
Mm-hmm.
it's it's really good that people are just becoming more informed. And the more information you're able to
Mm-hmm.
give at your appointments about your
Mm.
periods and what has clearly changed, the easier it will be for the doctor you're seeing to move you on to the next step in managing.
Absolutely. 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 Agree. Thank you for that. Also, what are other concerning things, like if I know we talked about PMS a bit earlier on, you know, if you're bleeding between periods, is that something that you should be concerned about? Is it something you need to call your doctor?
Yeah. So again, that's what we talked about, isn't the irregular periods, bleeding in between what should be
Mm-hmm.
the normal cycle. Yes. So that again needs assessment, because, it could be one of several things.
Okay.
Is does this person have an underlying condition? We
Mm-hmm.
mentioned polycystic ovaries, endometriosis, do they have thyroid condition? So
Okay.
there are several things that that would need to be looked into.
Mm.
So
That makes
that will require the investigations again
mm.
to sort of find out, are they on contraception?
Mm.
Because there's some contraception that can cause, irregular bleeding.
Ah,
So it's just looking at those things and then trying to identify what it could be and then taking steps to address it. So if, say, you have a woman who is on a mini pill, progesterone only pill, she's breathing irregularly, then
mm-hmm.
you might want to discuss, sort of changing that. If from what she's telling you, it's sort of tied into when she started the pill, then you might start to think, okay, it could possibly be that. Let's change it.
Okay.
But it's just around having that initial discussion, seeing what the issues are. Is she bleeding after intercourse,
Mm-hmm.
which again could be in between her periods? Because if she is, then that's again is a different ball game. That needs an
Definition.
examination and further tests. So
Mm.
a woman knowing her body, understanding her body, keeping an eye on it, because yeah, you still have women that can't remember their last period, don't really know. So it's important to do
To know.
these things, to make note of these things,
Mm-hmm.
definitely.
Mm. Definitely, journaling is the way
Mm,
to go. Yeah, and if you have to use the apps, please use the apps,
yes,
just to help you track, and then you can just
absolutely.
go somewhere to check,
Yeah,
oh, when was the last one,
yeah,
when's the next one due?
yeah.
And if there's issues, you can definitely just quickly get your numbers and your details to help also your doctor, you know. Um, Also, one other thing that I wanted to ask is about, so is it possible that you get into menopause and then you can start to bleed again? Is that something that can happen? And is that something to be concerned about?
It depends at what stage, because if you're sort of perimenopausal,
Okay.
meaning you're not quite post, then you could still have bleeding. So you could have a woman saying, I haven't seen my period for 6 months, and then or 3 months, and I started bleeding again. That probably means she's not quite post.
Mm-hmm.
But if you have a woman that's completely post, meaning it's 1 year
1 year.
since,
Mm-hmm.
yeah, after her last period, and then bang, she starts to bleed, then yes, we do worry about that kind of scenario, and we would want to have it checked. So normally the protocol for that is, if you find a woman post menopause bleeding, she needs to be referred, fast track to go and see the gynecologist.
Okay.
Yeah, so bleeding after postmenopausal is a concern, but
Okay.
it's not unusual for women that are still going through the
Very.
perimenopause, where the periods are still erratic. They don't bleed for a month. It comes. They don't bleed for 2 months. It comes. Yeah, that's. But
All right.
again, all the other things still apply. So is it heavy? If she's bleeding heavily, you still have to manage it as you would, you know, someone who still has regular periods. Yeah.
Okay. All right. So I mean the bottom line is, honestly, I would say don't ignore the signs, that
No.
the body tells you, subtly sends to you, or the pattern or the color,
Yeah.
gives you. Look into it, ask questions, read up on stuff, yeah. And if you still want to know more, just book a GP appointment and go and have this conversation. But journaling does help.
Yes,
But please
definitely.
don't ignore the signs. Don't, once something is not your normal, ask
Yeah.
questions. Talk about it. Bring it up with your professional health provider. So, some of the questions were actually, we've covered most of the questions that I had around the patterns and the flow which we have used. But there was one last question I'm going to leave for the last. I wanted to also talk about tips, for hygiene. And earlier on, we're talking about some people using pads, tampon, and the menstrual cups. Actually, about the menstrual cups, do you? Oh, you
Yeah,
okay?
I'm fine. I'm
Are there
fine.
people who can or can't use the menstrual cups?
Yeah. Excuse me.
Well,
Yeah. So I think it's similar to you know, even the tampon, you know, it's not for everyone. And some of the dangers with the tampon is what we've seen, where, you know, people forget to take it out.
Forget?
Yes. Oh yeah. Yes. Pe-
Yes. Okay.
people forget. I'm sure if you ask Dr. Oman, she'll tell you. And it's not pleasant for
Wow.
both people, the person wearing it and the person that would have to remove it.
Sorry for the person that has to remove it.
Yes.
Oh
But
dear.
the fact that actually, you know, it can
Can
cause
happen.
infection, it can
Mm.
lead to blood infection, sepsis. So, you know,
Oh, wow.
it's something, you know, women should be careful about. So those are some of the things young ladies are starting out, you know, for them to be, you know, counseled about, you know, using tampons and things.
Mm.
The menstrual cup, again, you know, it's not again, it's not something, not many women use it as compared to, you know, using a pad or a tampon.
Mm-hmm.
Because one is you have to have the anatomy, you know, if there are any issues with, you know, how the cervix sits and all that, it might be difficult to use the cup.
Mm-hmm.
So those are the things. Not many women really like it.
Mm.
I mean, I don't have any personal sort of experience with using the menstrual cup,
Up.
but I know that, you know, some women like it. But again, similar to, you know, the hygiene measures you would take, you know, during periods, it's really important to empty it properly, you know, keep it clean, because it's something that you reuse, isn't it?
Yeah.
Uh-huh.
And they stay longer, isn't it? Because with tampon and pads, 4 to 6 hours, 4 to 5 hours,
You have to
kind of thing.
change it.
But
Yeah,
with the menstrual
you
cup, it can
can
stay
keep
up to
it
10
longer.
hours.
Yeah. So yeah, it's what's that thing? What's that thing they put on bread that you either like or you hate? I'm trying to remember the name now.
Right.
Marmite, Marmite.
Oh,
So it's a Marmite type situation. You know, you either like it or you
you
don't,
don't.
you know, menstrual cup. So again, because it's reused, it's important that, you know, it's cleaned properly, you know,
Absolutely.
because it's not discarded. It's good for the environment, I suppose, but, you know.
Indeed. 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 Wow. Well, yes, just making sure that it's changed
Yeah,
frequently, well, as it should, you know, and like the menstrual cup being
yeah,
emptied,
yeah,
you know, properly to avoid infections, especially. And
yeah,
toxic shock, isn't it?
yeah.
And
It's
avoiding toxic shock.
sorry, I missed that. It froze.
I said so that you avoid infection and toxic shock.
Yes, 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 which you can also get from
Tampons.
tampons too. Yeah.
Mm.
So yeah, that's really, really important. It's really, really important. Um, I mean, I've had experiences removing retained tampons. It's not pleasant. I can tell you that, you know. But you know, and usually once if it happens and it's removed, the woman has to have antibiotics
Of course.
just because of the risk, how, you know, how risky it is. So yeah, if you're someone that is a bit forgetful, don't do it. stick
Being a bit
stick to the
forgetful.
pads.
Oh, amazing. Really stick to pads. At least if there's something between your legs, you will not forget that.
Yeah, exactly.
Oh, amazing stuff. Thank you so much, Dr. Moji. If anyone's got a question for Dr. Moji, please put it in the chat and Dr. Moji can help us to answer the questions. Earlier on, you were talking about, we mentioned briefly about lifestyle. You know, sometimes if the flow or the pattern of the period, you know, changes.
Mm,
Some of the things you also look at is, you know, maybe stress level or
yeah.
lifestyle, you know, for women, especially women with PMS,
Yes.
you know. So, okay. So that's something that as a GP you will usually look into to before you start to
Definitely.
mm. Mm,
Definitely. I think lifestyle, when you talk about a healthy lifestyle, healthy living, you can't underestimate it because it impacts everything,
mm,
and
yeah.
periods are no different. So
Mm,
it's really important. Stress, extreme stress, most times what happens is, a woman's period might, stop
mm.
because of that stress. Sometimes it's
Stop.
stress in the form of, sometimes in the form of, athletes that do extreme sports,
Ah,
extreme exercise, extreme dieting, all of these can make periods irregular or even stop. People with eating disorders, it's not unusual to hear that their periods are irregular or have stopped. So that's the effect of stress on the body on periods.
periods.
So all of these things are questions that will come up, if a woman presents with period problems.
Mm. Oh, awesome, amazing. This has really been helpful and educative. Um, honestly, like Dr. Moji said, know your own normal, and anything
Mm,
that's outside normal, look into it, ask questions, investigate it. It's important that we do our own due diligence as well and do a bit of journaling. So, but even if you're not completely right, by the time you're in front of your GP and they're asking you these questions and some of the things you've read up, you can, correct
yeah.
the wrong things you've read if possible if you have been googling stuff. Do not do Google alone. you know I don't know if it's ever happened to you. Well, it can't happen to you, you're a GP, but for me sometimes I'm feeling this pain and I'm like, okay, let me Google what's going on,
uh,
and yeah, what's up that when you start looking, you're like, why is
yeah, Google,
I'm only just
Google
feeling.
normally flags up the worst case scenarios, and then people panic. So, yeah, it has its place, but, it has to be interpreted as well.
I did go, yeah, accurately, absolutely, I agree. So don't go by Google alone, but we cannot overemphasize. Honestly, ask questions, join communities where we're having conversations like this.
Mm,
Talk about it.
definitely.
It's okay. It's normal. Well, we should make it normal, especially coming
Yeah,
from you know our background. We don't like to talk about things. We like to make things hush hush. There's no hush hush about periods. It's
no,
okay. We all
yeah,
do it, you know. So let's talk about it. If something's wrong, let's address it. Get help, and speak up. And again, journal, 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 journal. Write your stuff.
definitely.
Write, your own particular variation down so you can get help on time, and if something is not right, you can catch it early enough,
Early,
you know.
absolutely.
Yeah, so that you're not like
Absolutely.
when you go and see the doctor, you freeze and you forget all the things that you were determined to go and ask. So I find
Yeah,
out that writing it down really helps me a
it
lot.
it does.
Mm.
It does.
Mm.
And if your periods are different for one
Uh-huh.
month, it's okay. Don't, because it could just be, hormonal blip that will settle. So if, your GP says, well, okay, if it's just been this month, it's okay.
Mm-hmm.
You can watch it for another month or
Mm-hmm.
two. That's okay. Now, what is not acceptable is if you go and say, look, this has been going on for 3 months, for 6 months. I'm really fed up of it now. And they say, go and watch it. No, that's
What
different.
are you watching
But
again?
yeah,
After 3 months, after
yeah.
6 months, yeah, you want to get
So,
help. Mm,
yeah. So,
absolutely. I agree. I agree. I agree. Trying to look if there's anyone's asking questions, but this has been useful, honestly, and helpful. And for me, even around the that severe PMS, honestly, also getting to know that okay, sometimes to do some a bit of elimination,
yeah,
especially around lifestyle
yeah.
and stress, and
Important.
you know, and whatever underlying thing that might be,
Yeah.
picking that up and see what's causing all of that is useful.
Endometriosis, adenomyosis, these are things that affect periods. Periods are heavy, are painful. We've heard stories on FHF, programs. We've had testimonies from women.
Yeah.
Um,
Yeah.
you know, getting that information, making it clear when you see the doctor. I think, it's easier for you and the doctor to come to a decision as to how to move forward. That way women are not, suffering for years before getting help.
Help. Absolutely. Absolutely. I agree. Know you're normal. Even as a heavy bleeder, honestly, there's a time when it's not normal anymore.
Yeah,
Ask those,
exactly.
ask those questions, and also because of the psychological and emotional stress that comes with, especially if you're a heavy bleeder and bleeding heavily and having to go around. I mean, there was a time, in my life where I don't know if you know the tenor pads, that's nice one.
Yeah, yeah,
I will double
yeah.
two tenor
That's
pads.
not right.
No, it's not
That
right,
is
but
not
that was my
right.
so I, even though it's not right, but for some reason I was just coping. I was
Yeah,
just coping. I was like, okay, at least I can buy tenor
yeah,
pads and use to, but
yeah,
that's not even right. We shouldn't have to live like
yeah,
that.
yeah.
And the emotional stress, I wouldn't want to go to work.
Mm-hmm.
And then when with the fibroid, it was really bad and all of
Mm.
that. I don't even want to go anywhere. At some point when I was bleeding for 2 years nonstop. I didn't want to go anywhere. I just stayed
No,
my, and you can't
yeah,
sit on some chairs. You have to, that's not a
yeah,
good feeling, you know. So get the help, connect with women, join groups, communities talking about these things. If it's fibroid, if you have underlying issues, like I had fibroid, so I
mm,
knew that was why my period was that
was
heavy, but
heavy.
I didn't deal with the fibroid earlier on time.
Mm.
We're not talking about fibroid today, but actually, it's July isn't a fibroid month, so
Oh,
we'll be talking more about fibroid,
okay.
and all of that. But honestly, as women, let's get help. Let's
Yeah,
talk about this. It's okay to talk about it.
it is.
Okay, it's fine to talk about it.
Yeah.
And let's educate our daughters, our sisters, younger sisters, our nieces, the younger female generation. It's okay. Let's discuss these things with them and help them.
Yeah, I think they are definitely more, they're definitely more informed and more
Oh
open
yes, oh yes,
to
oh yes, oh yes. But it
discuss.
also helps you talk about it, at
Yeah,
least, even though they're getting their own information online and all of that,
yeah.
have those conversations, just to put their minds at rest. Thank you so much.
Mm.
Oh, 2 minutes past. It's been lovely
Oh,
chatting with you.
is
Thank
it
you,
8
Doctor.
already?
I know it is.
The
It is.
time flew by. Time flies
Indeed.
when you're having fun, isn't it?
It does, it does, it does. Thank you so much, Dr. Moji. Thank you for sharing with us
Thank you for
and
having me.
helping us to decode these patterns and colors,
Yeah.
for periods. And please, women, let's not ignore our signs, our not normal signs. Talk about
Hmm.
it and do something about it. Thank you, everyone. I hope this has been useful and helpful. This is the FHF support network. We have relevant conversations like this one. We help each other, educating and sharing, encouraging women to speak up. It is okay to speak up, and let's help each other. Have a lovely evening, everyone. Thank you, Dr. Moji. I'm grateful.
Thank you.
And
Thank you.
see you
See you
soon.
soon.
Good night, everyone. God bless you. Thank you.
Thanks.
Thanks for joining. God bless you. I hope you
Bye.
useful and helpful. Good night. God
Good
bless.
night. Bye. Bye.
Thank you, everyone. Thank you. I hope you found it useful.